We'll go ahead and call this meeting to order. Councilor Anglin, would you like to give the invocation?
I'll bow our heads. Gracious Heavenly Father, I want to thank you for this beautiful first day of spring. Thank you for safe travel down here. We hope that you'll give us safe travel back. We ask you to look over our meetings today and guide us to make real good decisions for our Cherokee citizens. I ask that in His name, amen.
Shelby, roll call please.
Yes, sir. Frankie Harvey. Ryan Warner.
Aye.
Bill England.
Honey?
Keith Austin.
Here.
Jack Baker.
Here.
Harley Buzzard. Joe Bird.
Honey.
Sean Crittenden.
Honey.
Don Garvin. Wanda Hatfield. Honey. Rex Jordan.
Here.
Dick Lay.
Here.
Curtis Snell. Here. Janice Taylor. Here. David Thornton. Victoria Husquin.
Ani?
David Watkins. We do have a quorum.
Thank you. At this time, I'd ask for approval of the minutes.
So moved.
Second.
All in favor?
Aye.
Moving down to reports, starting with the Claremore Service Unit. Mr. George.
Hey, George.
We started this last week on the emergency room renovations I've mentioned 2 or 3 times. So we've got that started. In addition to that, I think I told you last month that we had started renovations on the women's health area there on the east side of the hospital, adding a couple of exam rooms there. We've started some renovations there in the surgery clinic over by pediatrics, adding a couple of exam rooms there and some storage rooms. And then we have begun a major remodeling there just south of the operating rooms in Central Sterile where the sterilizers are. We've purchased a couple of new sterilizers. The ones we had were rather old, and we're going to have those put in hopefully by we should wrap that up hopefully by the end of April. So those are the major projects we have going on. I am still waiting on Hillcrest to shoot us another draft of their contract. We negotiated, we sat down and we talked about it, and we sent it off to the attorneys. As soon as we get that back, we can get that, hopefully we can get that signed and start sending our folks there in town to Hillcrest at Claremore for orthopedic care. So, any questions?
Councilwoman Taylor.
Is there a sticking point on this contract for orthopedics? This has been going on it seems like we're going back and forth, back and forth. Is it money? Is it, what?
Attorneys and legal language. They, to be blunt, they want their language in, and then our federal acquisitions folks, they have language that they have to have in there, and it's gone back and forth. We agree on the pricing structure and the fee schedule. It's just getting their legal folks to get on the same page with our legal acquisitions folks. And that's, in a nutshell, that's all it is.
Okay. All right, thank you. That's all I have.
Anyone else? George, thank you. Great report.
Thank you.
Next, Ms. Connie Davis.
Thank you, sir. Nice gentleman there. Good afternoon. I was outside too much this weekend, so apologize for the allergies. Hopefully you can hear me. Okay. Looking at our report for January of this year, overall patient visits for the health centers and the hospital are up 4,500 patient visits from this time last year. So we're really excited that we continue to expand access and improve services to our patients. Breaking that down a little bit, dental in particular is up 1,700 visits, which is really good. And we know that we've increased appointment times and still seeing emergency visits, and we're proud of that. Down below, and I'm on page 5 in your report for your reference, is a new format. We're reporting ER visits, and in January, that was the beginning of flu season, and we began to see an increase as we do every year. But I think it's also good that we report and explain to you guys that had a medical director, Dr. Sharon Smallwood, assumed the medical director role at the hospital locally. And during January, she was covering both the medical director role of ER and the hospital. And I can't tell you how much work that woman has put into maintaining the quality. Dr. Katie Hughes has been put into the ER director role in that month, I believe. And through their management, we maintain a left without being seen rate of 3%. So kudos to them. No additional staffing in the ER. I mean, it's just remarkable, and I'm really anxious to report the February numbers to you as well, because I think we broke another record, over 7,500 visits in that month. Good job to them and the staff. We're slowly trending upward on our revenue, still not exactly where we want to be. Our goal is to be at 10 million a month, but we're getting closer and closer. I know last week I get reports every Monday on cash flow and what we're billing, and last week we billed out $3 million. Now, of course, we understand we won't collect all of that, but it's still a good number to look at, and we anticipate a certain percentage of that coming back to us. Page 8 talks about our monthly cash flow, and you can see that it's trending upward and steadying out right now. There's a report on enrollment for the Affordable Care Act in the respective clinics, and a shout out to Three Rivers, Bonita, and Redbird. Those people are working hard to get people enrolled in the ACA, so just make sure to thank them and the work that they're doing. The big benefit to Cherokee Nation, of course, is that usually saves us a significant amount of money in contract health services when we have patients enrolled in the ACA. A top diagnosis by clinic threw a new one on me, and I'm hoping to have a report on this by the end of the day. Generally, we see type 2 diabetes and hypertension at the top of everyone's list, but there's a new code showing up, encounter for administrative examinations. So we're looking into that. I just read this morning, and we're going to see if we can understand what that code means, and I will give you an email or follow up next month and help you better understand that as I do. Some highlights from the clinics. In January, Christina Hines, APRN, started as a full-time provider at Salina. We're really excited about her. Cooey Scooey opened up 135 new charts. A busy clinic up there. In Bonita, the Gasdorfs, we've talked about them for 6 months, I believe, and it's a husband and wife who've moved to the area. We're working with the realtor up there that's helped us recruit and get them settled in. So we have a husband and wife physician there, and also Randy Elrod, an APRN, joined that staff. And Wilma P. Mankiller achieved a certified healthy business recognition. So I believe all of our health centers have achieved that certification now. In regards to No Water, Councilman Lay, I know we had a few exchanges of emails. Got an email this morning from Stephanie in recruitment, and we have a locum tenens who is an IHS payback who's been working there, and she's interested in agreeing to come work for us to do her payback back there in No Water. She's from Claremore. So that'd be great, especially since she's from close to that community. We won't have to worry about integrating her into the facility or the community. And they have a lead on a PA who specifically has applied for No Water. So you never know. They've improved some accesses and ways to advertise for recruitment, and it's paying off very well. So we appreciate the recruitment staff. Our healthcare our health IT staff and Healthcare Information and Management System Society is a nonprofit organization focused on improving healthcare quality, safety, value, and access via information technology. And they've awarded Cherokee Nation Hastings Hospital with Stage 6 of HIMSS analytic electronic medical record adoption model. It's a mouthful, that's why I'm having to read it, sorry. This distinction is in recognition of our accomplishments in implementing technology solutions with the ability to improve patient safety and quality of care. What that means is our transition with our electronic health record and the increased and improved safety measures that it has, like extra checks when you're getting your medications prescribed. Generally centers around pharmacy safety measures before they're dispensed, before they're administered. There's lots of new steps, checks and balances, but our staff has worked really hard, and we've received national recognition for our success in that. So kudos to the Health IT team staff, but also to our staff in the process of achieving that accreditation. We performed 358 surgical procedures in the month of January. And I don't know if you're aware or not, but we do sleep studies at Hastings. We do have a lot of those that are referred out, and we try to do those within our own system, and we did 85 of those. And we did 22 at-home sleep studies. We completed our youth risk behavior survey. We've received input from the CDC and are making preparations to distribute those survey results to you, hopefully in the next month or two. And in our public health accreditation, we have new standards. That's what people like to do, is make new standards and regulations to see if we can keep up. And we're determined to do that. We are now working under new standards and preparing for a reaccreditation. Just a little over a year ago, Lisa led the charge, and we successfully became the first tribe to receive public health accreditation. And a shout out to Lisa. I think she's going to serve on another survey for them in surveying another tribe getting accreditation. So I think that speaks to the respect and expertise that Lisa brings to the public health department. What else? A few more highlights here. Ginger Glory in our quality management department has been asked to serve on the advisory board for our accrediting agency of DNV. And we're really proud and honored, and it shows, the expertise and confidence that these accrediting agencies have on our staff and our ability to deliver high standards of care. Ginger's going to be out on some medical leave for a while, and Brian Hill will assume those responsibilities in her absence. That's my report for today.
Any questions? Councilman Knight?
Thank you, Mr. Chairman, and that's good to hear about NOAA. Is that a new doc then, if it's paid back 6
Yes.
years ago? What, how about OSHA later?
OSHA, I don't recall, the regular staffing report that we've been sending wasn't in this one, so I can't reference it. But I believe there was one gentleman interviewed for both NOWADA and OSHA later from our residence program. And so we know we'll get him one place or the other. He wants to stay in the area. Waiting for him to decide in May, I guess.
Sounds good. The PA, is that for NOAA?
Yes, sir. Yes.
Anybody else? Councilman Crittenden?
I never heard back from the 7-year-old with colossal extrophy. Is that
Yes, I've sent that. We have a way to take care of those issues.
the pads and the sterile water?
Yes.
Okay, and was the family notified? Or?
No, I've communicated to the clinic, and I'm trying to decide which, we either take care of it from a clinic or through MERP.
Okay, and so you'll just let me know, then I can let the family know?
Mm-hmm. Or I'll have Christy call them as soon as we.
All right. And also, does Hastings have the rash room like clinics do?
We do.
Just had an incident the other night where a small girl had a bad rash, and someone overlooked to either put her where the rash room patients stay, or anyway, it was a 6-hour ordeal and got pretty dangerous. But
Okay.
if you could look into that, and Also, had one other question about the test strips for diabetes. Yeah. Are those pretty, can the patients get those fairly easy?
You're required to maintain, or the funding that we get to provide those requires us to have documentation of their blood sugars and keep certain logs. And so as long as they are maintaining those, they can get those.
Maintain the logs and so there shouldn't really be any time where they should have to go buy them if they're keeping those logs, is that right?
Well, it depends on how often the patient is checking their blood sugar. I'm diabetic, and so sometimes I check my blood sugar more, and if I need to, I'll buy extra strips at the pharmacy. But they should be following their physician's orders and should be able to get the appropriate number of test strips that they need at the clinics. And if they're not, they can talk to their doctor and they can make a change in the order, and usually that's what the issue is, if someone doesn't feel like they're getting enough.
So they'll work with them if they feel like they
Yes.
need more. Thank you. Thank you, sir.
Councilman Buzzard?
Yeah, I only have a couple of questions. Last month, I asked Brian about the audiology department there at Hastings. I've gone to there and to that department, and it's a one-man show.
Yes, it is.
I mean, he answered the phone, he scheduled my appointment, he did my device and everything. Is there any way, why don't we get him some help? Is he through eye test contracts or?
He's, well, we don't have funding right now. We're budgeted for one audiologist, and we're limited, as you can see, by space considerably. But the new expansion, of course, has addressed that need and will allow us to expand those services.
Okay. I was shocked when he did all that stuff.
I think he has an assistant, so he must have been out of the room the day you were there.
And he made me an appointment and told me to come in and plan it. I don't know what is going on.
He is a busy guy.
The other thing, and we talked a little bit about the budget over in behavioral health last month, and really never got an answer out of it. And I don't have those numbers with me today, but it was like a total amount of money that we'd allocated last year, and then this year we cut it down over 60 to 70%, and I think they were about out of money. Are you aware of that?
No, I'm not.
Behavioral health. Would you mind checking into that
I
to
sure
make sure
will.
we have budgeted funds in that particular program? Because mental health affects a lot of us. A lot of our people out here is on meth, drugs, stuff like that, and we just sure need to make sure that we've got enough budgeted money in there to help those people out. The other thing, I had brought this up a little bit, but I just wish you would check into the IT department there for the health department specifically. I've had some calls about some things that was going on in there. It really didn't sound too good. Didn't sound like we had didn't sound like we had some happy employees. And I realize there are always going to be this type of stuff within the organization, but this seemed to be a little extreme to what I was told. So if you wouldn't mind, if you just do some checking on the thing. One thing that really kind of caught my attention is a statement that was made by a supervisor. Let me just tell you what was told to me. This guy was doing something on a program to make it work, and he said, well, this is the way we've always done it here at Hastings or IT. And the guy who's non-Cherokee that was his supervisor, he said, well, I want it done this way. And he said after it did that, and I guess whatever he did was going to work, he said, so you should have listened to the white man. No, that's not a good statement to make
No, it's
around
not.
Cherokee, so
No,
check
it's
on it.
I
please.
sure will.
Okay, thank you. Thank you, sir.
Speaker Bird?
Councilor Buzzard, where was that happened?
It's an IT over in the health division. They have their own IT department over there. And so that really caught my attention.
Yes,
So
it catches mine too, sir.
please check on that.
Absolutely.
We can't have that happening, or it should not be happening.
I heard about that same incident.
Is that right?
Yeah,
Well, so what I'm saying is you've heard about it too then. So.
yeah.
We
Okay.
will certainly address
Please
that.
check on it for us.
Yes, yes, Mr. Chairman.
Yes, sir.
Hey, Connie, last month, Councilor Austin inquired about providing assistance for Cherokee elders, speaking about some of the medical terminology that they use in those clinics. We have Cherokee speakers in most of our clinics, correct?
We do in most of our clinics. I couldn't tell you off the top of my head a valid number on how many are at each respective clinic.
Well, I thought we did. Second, what about our automated call reminders? Or is that still in place?
If it's for appointments, we have staff are supposed to be calling to confirm appointments the day before an appointment. We have clinics and the hospital both call in and do some pre-registration works to keep patients from having to go to registration. So they may call you and say, Mr. Bird, confirming your appointment with Dr. Davis tomorrow at this time. Is this still your address? Do you still have this insurance? And
For search for like appointments, then they still may do that.
they should be.
Okay, all right. And last, I just want to commend your staff. I was looking at the membership. We have 10,611 and total visits, 9,889 at the Wellness Center.
Yes.
And Shirley Goodland and her staff during spring break, when everybody else was taking a spring break, her staff was providing recreation and activity for school kids there. Really did an outstanding job, Lisa, your staff did, so.
It's a very committed team.
Yes.
Very is.
So anyway,
It really is.
it's working there. Thank you, Mr.
Thank
Chairman.
Councilman Vasquez?
Yes, I just have a quick question, and it's kind of related to what Harley was talking about, audiology. Can you refresh my memory about, if I have a Bonita client that needs hearing aids, does everybody go to Hastings? Or
They
is
do
there-
right now.
Okay. So if they get their hearing aids there, and I know you have to have a follow-up, usually a few weeks after, so they have to go back to Tahlequah and do that too, right? Just checking. And I wanted to make one note that Shirley Goodland is my cousin.
Oh, really? I didn't know that.
that.
She's doing a job. Of course she's doing.
I didn't know that.
Thank you.
Councilman Taylor?
Okay, so I need a walkthrough on contract health. We all get calls. That's probably the biggest thing we take. And I'm hearing more and more and more, you're not getting it, we're out of funds. And so can you explain to me, I know that we get our dividends, it's not a one-time thing. So are you just budgeting on last year's dividend and then it's already spent already, or what?
It frustrates me to hear we're out of money because there's a contract health financial report in your packet as well that shows you we're clearly not out of money. We're spending it as fast as we can.
So why are the patients being told we're out of money?
I can't explain that. I'm sorry. It's horrible communication on our part.
Okay.
And so if you have a particular clinic that we can discuss maybe after this, I'll be
Brett's
glad.
gonna discuss with me one of the issues, one of the
Okay.
people when we're done here, so maybe that will help with that particular case. But I hear it probably 3 times a week, that a patient has been told, you're not getting your surgery, we're out of money.
Something you have to keep in mind is when I say I'm excited and I tell you we've increased patient visits by 4,500, that means contract health spending is going to go up a percentage of that. And we are working hard to maintain, we still have a 97% approval rating, and it's probably closer to 100% the majority of time. But we have got to start controlling our spending so that we don't overspend and have a year like we did last year, but try to maintain the same level of access for everybody. And we're working on ways to get people and encourage them to sign up through the Affordable Care Act. I have a feeling that when they're being asked to do that on elective cases only, that they're not hearing it that way. They're hearing they don't have the money. And so we need to work on our scripting better, obviously.
Okay, and since you brought up the ACA, I wanted to point out, somebody told me, and I think it was you, that another benefit of that, not is just that third-party collections, but that sometimes on elective surgeries, the insurance will go ahead and pay for them because the referral was from an IHS facility, something to that effect.
What it is we can bill the insurance company for, and Brett could probably give you numbers on spending, for like a knee, elective knee or shoulder, would cost what, 20 grand?
Once a knee would be, say, 18.
18,000. So we bill insurance, of course, first, and then that leaves us, Cherokee Nation, only spending, instead of spending 18,000 for a knee, we would spend maybe, depending on the insurance, of course,
1,500 maybe?
1,800.
15, yeah.
15.
The-
So you can understand our passion. We're not trying to deter or delay care. We're trying to save money so we can do this the same as Tahlequah, no water for all of the patients. And it doesn't matter where you are. The rules are the same.
I think the difference that you've heard and that's right is there's the two key things with the Affordable Care Act. One, Indians don't have to, they're not mandated to get insurance, which that wasn't a good thing for me, but I'm biased. So the second is if you purchase an Indian plan, and that's what we funnel people to get. You check the box, yes, I'm an eligible Indian, I want to purchase this plan. As long as you're under the umbrella of Contract Health, I need a knee replacement. I've got this Indian plan. Dr. Gray saw me in Salina. Dr. Gray referred me. So I'm under this umbrella. Then there's no copay or deductible. That's what you're hearing. Now, because people get scared off, and I don't blame them. If you tell them you're going to pay $250 a month, you're going to have insurance. Hey, that's great. And your hospital deductible is $6,500. That's kind of I mean, that's a punch in the nose.
Yeah. Okay.
But if there's no copay or deductibles, and when I say no, I mean there's no $10 copay. No, as long as you're under the umbrella, it's all covered under CMS and Blue Cross and Blue Shield or whatever plan you purchase. So that's the thing. And that's what and we have people, Connie mentioned it very well. We tell them, we want to help you. We need you to go get screened for ACA. And I've had people that they're not going to have to pay anything. They're going to pay $25. They're going to, and they just don't get to do it. So.
Thank you.
That's all I have.
Councilman Lake.
Thank you, Mr. Chairman, and stay there, Brett. I've got a follow-up to this, but a constituent who came to Hastings for some procedure was released at noon and had to wait until, I think, 5 or 6 o'clock at night for their meds. You said you were going to get back to me on that. I don't think
Oh,
we
I
ever.
apologize. I thought I sent the email, but there was they were short-staffed in pharmacy that particular day. The orders weren't written actually until 3 o'clock that afternoon. And still, I know the time you called me was around 7, I believe. And they were just short-staffed. So we've talked to Jeff about that, and he's addressed that with his staff. On how to make sure discharges. And the other thing is, doctors will come around and they'll say, "Good news, Mr. Lay, you get to go home today." And they walk out of the room. And then they may go see 7 other patients and not get back to putting in their orders for several hours. And we just got our Medicare survey results, satisfaction surveys, and the only thing we score a little bit low in is discharge planning and communication. And I think that's where the gap is, because when I'm told I get to go home, I'm ready to go now. And I think we need to work on some scripting to say, I've got to write your orders, then pharmacy will have to come talk to you. So the expectation of the patient is really what they can expect, and not, well, I can go home now as soon as my husband or wife goes and gets the car. There's a process of things happening before you can just go home. And and I know that was the case in that situation.
So the follow-up, what should the follow-up be? Should a nurse or a scribe be with the doc each time that we go into a room and we anticipate somebody getting to go home?
Absolutely, I agree with that, yes. I think a nurse should accompany the doctor, or at least come back. But if you're taking care of 3 or 4 patients, you know which ones are going to go home. And I think it'd be prudent to the nurse to go in and say, now, I know he's told you or she's told you can go home, but this is what happens, so you can expect to go home around 2, 3, 4, 5, whatever the time may be.
So still stay in your room comfortably and not sit in that hard chair for 5 or 6 hours.
They should have stayed in that room regardless, so if they did not know that, then that's a whole separate issue. Because you can't release the room until the patient's gone.
Well, if they're released, then I assume they're shunted out of the room.
No,
That's what
sir.
happened here.
They're still in bed till the nurse takes them down in a wheelchair.
So from 12:30 till about 6. And this is the night, remember, that we had the storm.
I do, I remember it
Dark,
very
and
well.
we've got senior
I was eating
citizens
at
driving.
Chili's.
senior citizen driving their mom home, another senior citizen through the storm. That,
Yeah. I'm sorry that that happened.
need a
and
better
we
system. So, I don't know.
We agree.
Don't ask me to give it to you, but we
No.
need some sort of a better system.
We've already discussed it, met with pharmacy, and we're working on improving those processes.
Okay.
Communication and what the patient should expect is the main thing.
Thank you. And the other thing is I've heard a couple of things here today about the Affordable Care Act and how to sell it to our patients, to your patients, and elective surgeries. I think one of these days, maybe next time before this meeting, have a separate health meeting to explain to us what you mean by what you just said. Because elective surgeries to me may not mean elective surgeries to your patients or to me or somebody who needs a knee operation to walk or to get around better or a whole bunch of things. So your idea of an elective surgery and mine may, obviously, we're this far apart.
I agree, and we've actually been working on that very thing, a policy, and as soon as Mr. Hayes has the time to get that fine-tuned for us, we will share it with you. We'll be happy to share it with you.
And how it works and how the system works. What I just heard was a little bit different from what I thought it did. So if you could present just a presentation to us, in a separate meeting. We've all got these regular questions we ask and go over with, but I think what elective care and what it is and how it works. We all get calls, well, they're making me buy insurance. I'm an indent, I don't have to. And they're not providing service, and they're not providing health care, and they're not, you've heard it.
Yes.
And so explain to us so we can explain to our citizens.
We'd be happy to do that with Brett.
And also there's a patient rights book, pamphlet, and, I'm not sure what you're just saying is actually written down as a policy that you're referring to. The patient rights book that I know doesn't say anything what you guys just said. It doesn't relate.
Well, it's not a policy, so I'm sure that it doesn't say that.
Well,
It's a policy
But
book.
if you're operating under that policy, where's the guideline? Where's the policy?
We're, as I just said, we're working on that
I
policy.
know, I don't mean to be argumentative, but we need it
Yes.
so that we can all go forward together. Apparently, you guys are running down one road, and our patients and this council's on a different road, so if you could help us, thank you.
Be happy to.
Thank you.
Councilman Walking Stick.
Hey, Connie,
Hey,
behavioral health, do we have any money set aside in our joint venture for, Councilman Buzzard brought up some good thoughts. We are struggling in that area. Is there any funds set aside? Do we have a plan down the road to increase behavioral health or plans on
in the
that?
joint venture, there is additional funding for behavioral health services.
Okay, good. The next thing I'll bring up, had an elder go to Hastings to the optometrist, and they are going to charge him $200 for eyeglasses, and so couldn't afford it. He went down on those. Can't remember the place he went, but anyways, he found for another place for $50, and he was talking to me about it. And he's like, I thought there was funds available for eyeglasses and denture and all that. Is there still funds there, or are they depleted?
Yes, there are, and we are working on a contract with the NSU to shore up some of that.
Okay.
So after this meeting, I'd really like to know who that was, because no one
Okay.
should be having to pay out.
I'll give you the name after
Okay,
this.
thank you.
And we all know you're doing the best you can with what you got. I know you got a big department to handle. The young man, I sent you and Brett a text message a couple of days ago about a kid got his thumb cut off, went to Hastings.
It's all taken care of.
Okay. You guys would just in future shoot me a text, say done or completed or something.
I had probably 15 messages on that, and I'm not sure who all got the response, so I apologize if you weren't on one of those.
Okay.
So,
All right, thank you, Connie.
You
And
bet.
yeah, I know you got a lot on your plate. I know you're busy.
it's all right, it's what we do.
And then I keep getting phone calls on the mismanagement of doctors and, you know, the belittling and all that, what we talked about last month.
Mhm.
Have you guys done anything to look into that?
We do. We've asked the docs to schedule 2 patients an hour. We feel like that's a reasonable request. It's still not up to industry standards, and the majority of them have complied and agreed, but there are a few out there who are unhappy.
Okay. So those may be the ones that's visiting with me.
I'm sure it is.
Okay. So, well, that's all I have. Connie, keep up the good work. Appreciate you.
Thank you.
Thank you.
Thank you. Jack, did you have anything?
Yes, we go. On the optometry, are they making calls for appointments the day before?
I would have to check with Dr. Lighthizer to clarify that one.
Because they were not a month ago.
Okay, we'll follow up on that.
Okay.
Seems
And the other question I had last month was Christmas bonuses for the Cherokee Elder Care employees. They're paid
Yes.
as Cherokee Nation employees, but yet they did not receive Christmas bonuses. And I would think that anyone being paid as a Cherokee Nation employee should qualify for the Christmas bonus.
They are an agency of, where's Todd? I think, and I don't want to say it incorrectly, the Cherokee Nation. They're not funded by the Cherokee Nation. They operate on their own.
But they're still Cherokee Nation employees, they're W-2s, and I'll still have it as Cherokee Nation employees.
I will have to follow up on how that works
Because,
for those intents and purposes.
okay. Because if they're on the payroll as Cherokee Nation employees, I would think they should qualify for the bonuses, like all other Cherokee Nation employees.
Okay.
And it's my understanding that they are.
I will check into how their payroll works.
Okay, thank you.
What else do we have over here? Councilman Lay, or excuse me, Councilman Ingram?
Yeah, thank you, Mr. Chair. Connie, are we going to try to get more in line with the other local health facilities, like in our area up north and like in the Tulsa area? Because we're losing nurses and stuff going to the other facilities because they're paying more money.
As a matter of fact, we visited with HR. We have a monthly meeting, and we spoke about that about 2 weeks ago. And we are looking at nursing compensation right now because our clinics do struggle with retaining, especially in the Nowata area and Salisaw. I mean, it's NJ. They're the hardest ones to recruit. And so Sandy Hathcote's working with HR to analyze and do a current comp and hope to have something, make sure we can afford it, to roll out very soon.
Good, and I hope it's very soon because I know some nurses are looking to go to St. John's at Owassa and stuff because
Yeah.
just down the road, not far from Nowata at all, but
Yeah.
they're traveling, they're going that way. Some of them's coming from that way up anyway.
Yeah,
So we just need to pay those people more money.
we agree, sir.
And they're worth it, so, thank you.
Councilman Buzzer?
Yeah, just to comment, Connie, about the ACA Affordable Care Act, I think I like what we're doing. I think you probably remember an incident there in Jay that happened to the girl that was scheduled for surgery, then the day before they canceled and said you need to fill out the, I just think we need to be more, or those people need to be more cognizant about telling those people and do it up front, so, but I think it's good. I'm glad that we're doing it.
Well, thank you.
The other thing that, and I don't know this to be a fact, but on the patient service advocate, we still don't have one on our tank. And you were gonna do some checking on that because you'd
Yes.
advertised it, and the reason I say that is we really need that person up there to help all of our patients, but especially on contract health, or what do you do with this, or I can't get in to see the doctor and because they said it's full, and we just need that person up there.
I agree. I'll email Nason again and see where
Yeah,
that,
please check on it.
I sure will.
It's really needed there.
yeah, I appreciate the reminder. I assume if I don't hear back, it's done,
Okay.
so
Thank
that's a mistake on my part.
you. Thanks, sir.
Thank you. Anyone else? Councilman Crittenden?
I was just gonna follow up. Mr. Lay answered my question. I was gonna request on the ACA stuff, just a plain English, and you all said you were working on that too, so that we can, but that was my initial question. Also behavioral health. I had a guy needing to get into rehab, and he didn't meet, he has a record, you know, and so at first it was a terrible time trying to get him placed in a drug rehabilitation place. And you remember that email probably?
I do.
don't you? But,
Yes, I do.
So are we looking for some other options? I know this particular case, it was too close to a school for some of his goings on there. But can we look for something,
Yes,
you know?
absolutely.
It was just, you know, a lot of things has a litmus test, but I didn't think a
That
rehab
was
should.
challenging. Well, they have rules too, and so we have to respect those, but yes, we're looking.
Thank you. Anyone else?
I'm gonna make a comment. About 2 months ago, I made a request to put out a narrative to the council members about the Affordable Care Act and how it might affect the Cherokee Nation. I think you're working on that.
I believe that was sent to the council, Dr. Green?
We'd sent it out in about a week, your request.
We can certainly resend it.
Resend that because I think they're addressing some of that today. The Congress is.
We sure will. I apologize, we thought that went out, so.
Might clarify some of these questions that were asked today. Okay, thank you, Mr. Chairman.
Tommy, before I let you go, I've got a couple of things. I got a call from one of my constituents, and I know that Frankie got the same call. Had a relative, they somewhere in the mix showed up for an appointment and had lost a referral. Basically, she come up for a heart cath, and they didn't have the referral when they got there. They got sent home. And, you know, and I understand that process is kind of a three-pronged deal because, you know, you've got the clinic, you've got the hospital, and you've got the patient. Do the patients always, I mean, how informed should they be? I mean, to me, if it's me, I'm going to be very informed about what I've got, what paperwork I've got, but how are we educating our patients and stuff as far as what they need to have and, you know, and stuff like that?
The MIR should be doing that in the clinic, the people in contract health.
Okay.
Should explain to the patient. What I find a lot of times in those cases is sometimes those referrals are faxed, but there's an error on the receiving side, and we have no way of knowing they have not received those. All they have to do, all the vendor has to do is pick up the phone and call any one of us or send an email, and we can get that referral sent right away.
Okay. I think this one in the case was going to be taken care of at Tahlequah City, so that could possibly be the same problem, or?
I am quite confident it is.
Okay, okay.
And that, yeah, they have my cell phone. That should never happen.
Okay, all right, thank you. On the other note, back to eyeglasses, we supply eyeglasses yearly, correct? But if they have a pair, we don't supply another pair. Is that correct?
That's unless there's a change in the prescription.
Unless there's a change in the prescription. Okay. I'd gotten a couple calls from some elderly, and I know their biggest concern is what if I lose it, what do I do? And I told them, you know, please come back, you know, if that happens. But, you know, I think their concern is, you know, time and getting back and maybe a ride and different things like that. So just something to consider, you know, on certain patients and especially our elderly when, you know, I think they worry about other things more so than the rest of us do, you know, of course. But, you know, it rang a bell with me, and I can talk to you more offline. So one last thing, a good note. Last week, not spring break, the week before last, I had a couple of your public health educators come help me out at Gans, donkey basketball, and Lacey Wallace and Hillary Mead, and they were definitely the stars of the show, and I appreciate you for letting them come out, and you know, they're supervisors and everything, letting them participate, so I appreciate you. Thank you.
I'm glad you mentioned that because I completely overlooked it in the report. And the public health educators do so much in our community. You know, sometimes we focus on all the problems and challenges, and those guys are out there just all the time giving all the positives and doing a good job representing Cherokee Nation Health. And so we do appreciate it.
They came down from Hillary come from the Tahlequah area, and had some of Diane's come from Tahlequah, Little Kansas, all the way to Gans, and the people of Gans
Wow.
are very appreciative.
Well, good.
So,
Glad you enjoyed them.
All right. Anybody else? All right, thank you, Connie, for your report. Moving on to old business, I see none pending. And down to new business, I'd like to ask Councilor Lady Vasquez to take that. You're fine.
Okay. Yes, this is a resolution approving the contract for the Oklahoma Tobacco Settlement Endowment Trust, TSET Healthy Living Program. And I would like to put that in the form of a motion and also request that it go to full council tonight after its approval.
All right, we got a motion and a second. Any discussion? All in favor?
Aye.
Those opposed? All right. Announcements. Any announcements? Okay, the next meeting is tentatively scheduled for Monday, April 10th at 1 o'clock. I'll take the motion to adjourn.
So moved.
All in favor?
Aye.
All right.